Vietnam is among the latest countries in Southeast Asia facing a new wave of COVID-19 infections. The country's health minister has said a newly discovered variant could be responsible for the surge. Vietnam has seen case numbers double in the past month, but still has one of the lowest death rates. And the country is ramping up its defences to keep it that way.
The discomforts of the pandemic, known to many around the world, are now common in Vietnam too. Authorities in Ho Chi Minh City are ramping up COVID-19 testing, first focusing on high-risk areas. Residents are on alert amid fast rising case numbers. I'm more worried about the new virus variant. I have to wear a mask more often and also limit meeting other people. Ho Chi Minh City has been partially shuttered, with many businesses closed and public gatherings restricted. Some residents find themselves behind quarantine cordons amid local outbreaks. Students are vacating their dormitories to make way for a new hospital in preparation for the worst. The last flights to Hanoi have landed. The busy international airport is closing for a week. Vietnam recently announced the discovery of a suspected new variant, possibly merging types first seen in the United Kingdom and India. It says it will soon share test data for confirmation. Vietnam is in a race to vaccinate. So far, only 1% of its population has been inoculated. Only weeks ago, Vietnam had achieved a month of zero community transmissions. Its strict arrival quarantine measures and fast lockdowns proved effective. But COVID-19 is finding cracks, even in the most cautious countries.
And for more on this, I'm joined by Michael Tatarsky, who's based in Ho Chi Minh City. He is a journalist. Hi, Michael. Good to see you. Tell us more about this new variant that's causing a surge in cases there in Vietnam.
So there's still a lot we don't know about this variant yet. It hasn't been confirmed internationally yet. We don't know if it came from outside Vietnam and was just detected here, or if it came about during this outbreak. So that remains to be seen. It also remains to be seen exactly what its impact is on people who have it. There were reports just a little while ago in domestic media that younger people are getting more seriously ill in a northern province that has seen hundreds and hundreds of cases. So that's concerning. But again, we don't know what cases are linked to this variant or exactly what impact it has on people who have it.
Michael, as we heard in our report, recently Vietnam had a month, I think it was, of zero community transmissions. This new outbreak must be a blow.
Yeah, certainly. This isn't the first wave we've had since the start of the pandemic. There's been 2 or 3 other ones, more regional than this one. This is certainly the most serious in the entire pandemic, actually. But yeah, daily life had by and large been quite normal here. Obviously, no international travel, but domestic travel was normal. We could go to bars, restaurants, movie theaters, all of these things that many other countries have not been able to do for the last year. And here in Ho Chi Minh City, where not all non-essential businesses are now closed, similar in Hanoi and other hotspots with a lot of cases. So certainly this was something of a shock to the system.
And how's the vaccine rollout going?
Quite poorly. This is probably the weakest aspect of Vietnam's response to the pandemic so far. So the country's gotten about 3 million AstraZeneca doses through government contracts and the COVAX mechanism. But only around 1 million people have received a shot. I think the number of fully vaccinated people is under 50,000 out of a population of 97 million. The government is quickly trying to source more vaccine. There are also domestic vaccines in testing phases, but it looks like it's going to be several months before any kind of even mildly substantial part of the population will have access to the vaccine or a vaccine.
All right, that is journalist Michael Tatarsky reporting for us there in Ho Chi Minh City. Thank you, Michael.
Thank you.